This experience has shown us that wastewater and environmental surveillance can provide valuable information not only during a pandemic, but also as a part of a broader preparedness system. A key factor behind this progress has been coordination. Different technical, institutional, and operational capacities have been brought together around a common objective to detect risks earlier, interpret them correctly, and support timely action. Our experience has also taught us a clear lesson. Successful surveillance requires more than laboratory capacity or technology alone. It requires strong infrastructure, trained professionals, institutional ownership, trust, effective coordination, and sustained investment. Today, Turkey's vision in this field extends beyond infectious diseases. It also includes antimicrobial resistance, emerging contaminants, and the broader One Water, One Health agenda. Turkey's experience has also shown that the future of wastewater and environmental surveillance cannot be shaped by national efforts alone. No single institution, sector, or country can advance this agenda on its own. This is why international cooperation has been central to Turkey's approach from the beginning. In recent years, Turkey has supported efforts to bring wastewater and environmental surveillance into broader global discussions on water, health, finance, and development. From the World Water Forums to the UN 2023 Water Conference and the Global process, the objective has been clear: to move waste from a technical discussion to a practical preparedness and investment agenda. In this regard, the Waste Funders Forum that hosted by our ministry in Istanbul in November 2025 was an important milestone. It brought together development banks, philanthropic organizations, and international partners to align priorities and explore ways to scale wastewater and environmental surveillance at national and regional levels. Most recently, the fifth Istanbul Water Forum further elevated this agenda by bringing waste into a broader policy discussion among the water, health, agriculture, finance, and development communities. Today, this agenda has reached a point where the focus must shift from proving the value of waste to scaling it in a sustainable way. The question is no longer whether waste works. The evidence and country experiences are clear. The real question is how we can move from successful pilot projects to sustainable national and regional programs. This requires institutional ownership, sustainable financing, effective governance, trusted partnerships, and regional cooperation. It also requires waste to become an integral part of national surveillance systems rather than a project dependent on short-term funding cycles. In this respect, today's meeting in Baku is an important opportunity to translate shared ambition into practical next steps, to deepen cooperation, and to identify new opportunities for implementation across the region. Building on this perspective, Turkey remains fully committed to supporting regional cooperation on wastewater and environmental surveillance. We stand ready to share our experience, contribute technical expertise, support capacity building, and facilitate knowledge exchange with partner countries and institutions. As the co-lead of GLAVCON Training and Capacity Building Working Group, Turkey attaches particular importance to the development of practical and sustainable capacity across regions. In this context, Turkey is well positioned to serve as a regional hub for training and knowledge exchange, especially across the Turkic states, the Middle East, and the Western Balkans. Through the Turkish Water Institute, Suen Academy, more than 2,000 professionals from 53 countries have participated in international training programs in different areas of water management. Today, we are extending this experience to wastewater and environmental surveillance. Last November, in Istanbul, we hosted a regional capacity building program on WES for representatives from Islamic Development Bank member countries. This program strengthened technical capacity, promoted knowledge, exchange and supported discussions on how waste can be better integrated into national systems. Building on this experience, Turkey stands ready to work closely with the Islamic Development Bank, member countries, and all partners to support the development of a regional waste support platform based on training, technical assistance, and mentorship. Because no country should have to start from zero. It's important for us. Through cooperation, we can help countries move faster, avoid duplication, and build systems that are technically sound, institutionally owned, and financially sustainable. Our commitment will also continue through major international platforms in the years ahead. As the lead country for the Water for People and Ecosystems sub-team of the 11th World Water Forum in Saudi Arabia in 2027, Turkey will continue to support dialogue, partnership, and action on water, health, and sustainable development. I would also like to take this opportunity to announce that Turkey will host the 20th IVRA World Water Congress in Istanbul on 4 to 8 October 2027. We see this Congress as an important opportunity to continue this dialogue and to bring together the water, health, agriculture, environment, finance, and development communities around practical solutions. Ladies and gentlemen, wastewater and environmental surveillance is more than a technical issue. It's about preparedness, it's about resilience, and it's about protecting our people, our environment, and our shared future. Together, through the One Water, One Health approach, strong partnerships and sustained investment, we can transform preparedness into action, build stronger health security systems, and create a safer and more resilient future for generations to come. Thank you all.
Thank you very much, Mr. Deputy Minister, for sharing Turkey's valuable experience and vision for the future of the wastewater and environmental surveillance. To continue setting the stage for today's discussion, it is now my pleasure to invite you to watch a special recorded message from Dr. Chris Elias, President of Global Development Division at Gates Foundation.
The Gates Foundation. Thank you for the opportunity to join this conversation, and I'm sorry I can't be with you in person in Baku. I want to begin by thanking all of the distinguished speakers on the panel today, as well as Dr. Issa Faye, Director General for Global Practices and Partnerships at the Islamic Development Bank, for his leadership in bringing this agenda to the annual meetings. I also want to recognize Idrissa Dia and Nizar Zaid for serving as the Islamic Development Bank leads for this event. I would also like to express our appreciation to the leadership of the Islamic Development Bank for our long-standing partnership and commitment to advancing health and development priorities across member states. The Gates Foundation has valued our collaboration over many years and look forward to continuing to build on that partnership. We are only 6 years past the onset of the COVID-19 pandemic, and since then, the pace of public health emergencies has not slowed. Africa has borne the brunt of the recent Mpox and Bundibugyo Ebola epidemics, while also continuing to face the daily burden of pathogens that rarely make international headlines: measles, cholera, typhoid, hepatitis. And polio continues to circulate, with recent detections in Zambia and South Africa. This is why we are committed to multi-pathogen disease surveillance as a foundation-wide priority. Because early detection is the difference between preventable deaths and epidemics that don't happen. Wastewater and environmental surveillance is an important area of strategic engagement for us. This is not a new technology. We've used it to detect poliovirus since the 1990s. What has changed dramatically, accelerated by COVID-19, is our capacity to detect a much wider range of pathogens, potentially offering us a head start of days or even weeks before clinical surveillance might catch the same signal. Working closely with the World Health Organization and other partners, the Gates Foundation has invested in multi-pathogen wastewater and environmental detection implementation across Nigeria, Ghana, South Africa, India, and the Democratic Republic of the Congo. Countries are building directly on the polio infrastructure, expanding its reach to track measles and other pathogens that are national priorities. Our partnership with the Islamic Development Bank has evolved over many years, including through the Lives and Livelihoods Fund, which has demonstrated the potential to mobilize additional resources for health and human development across member countries while piloting innovations such as results-based management. We are encouraged to see lessons from the LLF increasingly informing broader Islamic Development Bank operations and the development of the new Islamic Development Bank concessional financing platform. What the Islamic Development Bank brings to this space that philanthropy and overseas development assistance alone cannot is the ability to move concessional financing at the scale and duration that national systems require. With the Islamic Development Bank, we have been proud to co-convene the Wastewater Environmental Surveillance Funders Forum, as well as the Wastewater and Environmental Surveillance Capacity Strengthening Conference for its member states last fall. Now we are looking toward the Islamic Development Bank's concessional fund as an important and timely opportunity to bring concessional financing to health security in ways that can outlast donor cycles. Investing in surveillance and response systems that work across disease programs rather than in silos saves money and lives. Last month in Geneva at the World Health Assembly, we had a side event called Epidemics That Didn't Happen, where we had the chance to share stories from El Salvador, Gabon, and Thailand, countries that detected outbreaks early and stopped them before they caused preventable deaths. These were proof points that it is possible to get ahead of a crisis rather than simply respond to one. That is the world we are working toward, one with more and more of those stories to tell. Countries with the tools they need to see disease coming, make timely, data-informed decisions, and act before an outbreak becomes an emergency. Thank you.
Okay, we thank to Dr. Elias for sharing his valuable perspectives. We will now move to our panel discussion. Before we begin, I would like to invite our distinguished panelists to the stage and briefly introduce them to you. Okay, I would like to start with Dr. Hanan Balki. Yes, please. Please, may I kindly ask to sit to reserved seat, please? Okay. Dr. Hanan Balki was appointed World Health Organization Regional Director for the Eastern Mediterranean by the World Health Organization Executive Board in 2024. She was previously Assistant Director General for Antimicrobial Resistance at WHO headquarters. Prior to this, she was Executive Director for Infection Prevention and Control, Ministry of National Guard, Saudi Arabia. She led the Gulf Cooperation Council Center for the Infection Control and the WHO Collaborating Center for Infection Prevention and Control and Antimicrobial Resistance, Saudi Arabia. Okay, thank you for being with us. Okay, our next panelist is Mr. Riyad Akunzada. He is the head of the Strategy, International Cooperation and Science Department, Azerbaijan State Water Resource Agency. He began his professional career in 2013 at a private company. After that, he served as a member of International Patent Research Working Group in Milan, Italy. Then in 2019-2021, he worked as a chemical engineer in Azerbaijan's water sector. And after 2021, he worked as an engineer at Azersu Open Joint Stock Company. After 2022, he held positions as a chief advisor and later sector head as the Azerbaijan Amelioration and Water Management Open Joint Stock Company. As the head of the Strategy, International Cooperation and Science Department, Azerbaijan State Water Resource Agency, he has played leading roles in projects focused on studying international best practices and improving water infrastructure in Azerbaijan in cooperation with international organizations. Thank you for being with us. Okay. Our next panelist is Mr. James Carty. He is the Deputy Director for the Middle East Gates Foundation. James Carty sets the strategic direction for the Gates Foundation's government relations, advocacy, communications, and partnerships across the Middle East. Previously, James worked extensively in the Middle East on policy and strategy at the executive branch level. He also worked with the former United Kingdom Prime Minister Tony Blair, supporting his work on government reforms and key priorities around the world. And our next and last panelist is the Dr. Ismane Elofi. She is the Executive Managing Director of Consultative Group for International Agriculture Research, known as CGIAR, since 2023. She previously held the position of Chief Scientist at the Food and Agriculture Organization of the United Nations. Prior to that, she was the Director General at the International Center for Biosaline Agriculture based in United Arab Emirates. Dr. Elofi has extensive leadership experience in agriculture, research, and innovation, having held senior positions at Agriculture and Agri-Food Canada and Canadian Food Inspection Agency. She has worked as a scientist with several international research organizations and has been a member of various strategy expert panels and advisory groups. Beyond her scientific achievements, Dr. Elofi has played a role through her service on global advisory groups and the boards of leading organizations, including Global Commission of Adaptation, Harvest Plus, IFPRI, and CABI. She was also a member of scientific group for the 2021 UN Food Systems Summit and of the CGIAR System Board. Okay, thank you, all of you, being with us. Okay. Okay, I would like to open our panel discussion with Dr. Hanan Balki. Dr. Hanan Balki, who has been playing a critical role in supporting countries across the Eastern Mediterranean region during a period marked by profound and overlapping challenges. The region faces a complex landscape of fragility, conflict, recurring health emergencies, the growing threat of antimicrobial resistance, and increasing environmental risks, all of which place significant pressure on public health systems and communities. Many public health threats today do not respect national borders. In that context, how do you see surveillance systems, especially wastewater and environmental surveillance, supporting regional health security? Beyond helping us detect infectious disease outbreaks early, what role can these systems play in monitoring antimicrobial resistance across wastewater, soil, groundwater, and agricultural environments?
Thank you very much, and thank you for providing some of the context of the region that I actually lead. Just to add to that, the Eastern Mediterranean region, which spans from Morocco all the way to Pakistan, also includes two of the last member states that still have wild polio virus. And of course, you heard Chris, and we have also James with us here, and also the ISBD, lots of partners who are working on the final stages of eradicating polio. So I'll touch on that a little bit. Also in the reports on antimicrobial resistance, which was my life for about 20 plus years, we still see that the Eastern Mediterranean region also has large numbers and trends of emerging, what we call them, multi-drug resistant pathogens, which leads to the phenomena of antimicrobial resistance. What we also see, just so that we understand the context very well, within those 22 member states, we have the largest conflicts, more than 50% of migrant population, more than 42% of internally displaced population, highest percentages of hospital destruction and attacks, and also loss of infrastructure over and over again in countries such as Sudan, Gaza, Yemen, and others. So when we talk about, if we want to talk about human dignity, that's another topic. But if we talk about health in general, these individuals that live in such contexts are facing some very dire challenges. Now, when we come to why is this important, to start with, because your question was specific also on antimicrobial resistance, people can start looking at this phenomena of resistance as the solution is to create more antibiotics, which is absolutely true. The pipeline for new antibiotics is dry. Because I'm in a finance, this type of platform, and you know this very well, to produce the investment needed to produce a new antibiotic is around 10 years, $1 billion, and within 2 years of using this antibiotic, it might become most likely resistant if there's no proper stewardship. So on antimicrobial resistance, we're facing a big problem. On the flip side, when dealing with our One Health agenda and colleagues within FAO and the Ministries of Agriculture, the need for economical sustainability on meat production and food production, fishery production, meat, poultry, and whatnot, the use of antibiotics becomes critical to safeguard the economical output of such activities. However, because the antibiotics used in the agriculture are the exact same antibiotics that I need to use in the most difficult ICU patient, we created, and that was my work for 5 years in Geneva, working very close with the quadripartite to figure out how do we create the frameworks to properly understand how do we produce stewardship and understanding between the different sectors. Now, this becomes very complex in countries of conflict, and that's why having newer modalities and building this capacity, and maybe in the upcoming questions I can tackle more on why is this important for polio, and maybe I can end with 1 or 2 critical examples. The surveillance programs for polio in 360 sites in 18 out of 22 of the Eastern Mediterranean countries is what's really saving the polio from also coming back from our region. There are other regions that also, especially the rest of the African continent. In 2025, when polio resurged and was detected in wastewater in Gaza, despite the conflict, we were able to vaccinate in 3 rounds close to 550,000 children below the age of 10 years, and we saved, not we as WHO, the partners, the Palestinian Authority, Gavi, UNICEF, WHO, the funders and the partners that actually support this activity to mitigate, because for 25 years there was no polio detected in Gaza. The destruction of the infrastructure, the running sewage in the streets, the drop in basic primary immunization. Within the middle of the war, we secured the capacity to do this type of immunization plan to mitigate and stop the further spread of polio. Without that wastewater surveillance that was so robust and so well maintained, we would have been in a much, much difficult situation. So I'm a big advocate for this work, whether AMR, polio, or other pathogen mitigation and prevention, and I'm very happy to be with you on this panel, so thank you.
Okay. Thank you. You already talk about the cross-border issues, but following on from that, what kind of cross-border cooperation and information sharing mechanisms you recommend to make this work effectively while still respecting national sovereignty, ownership, and trust among the countries?
Yeah, thank you. I did not address that. You're absolutely right, and this is the whole essence of our work in WHO and the international health regulations. So the whole idea is to detect signals as fast as possible and early as possible. One thing that I would say, which is maybe not so politically acceptable, but I wish for one day that we're not ashamed of pathogens, because there's no running away from outbreaks. And what we see in the capacity for reporting to the international health regulations when a signal comes up, and it's not because it's shameful, it's I think because it has economical consequences. But if we are super mindful that the earlier we detect, the earlier we intervene, we will mitigate bigger problems. So the collaboration is already happening. We have a great collaboration between the countries of the Horn of Africa on polio, for example. We communicate very well between us and UNICEF, the member states. There's also some good communication now between another group of member states within the EMRO region, Djibouti, Somalia, Yemen, and Sudan. They're working together also on certain areas. We are trying to support the advocacy for supporting public health authorities. Because if you have a strong public health authority, and this will come into institutionalizing this work, the collaboration between member states, strengthening their IHR, number one, strengthening their capacity and their knowledge at the highest level of the relevance and importance to this. And I'm now a true believer, we always have to link this to economies. Because unfortunately, health is not always a priority. So I think we win more if we link this to economies, and there's a huge link between economies. Of course, sovereignty is very important, and we definitely respect that and work towards securing that as well in the middle of all of this work.
Okay, thank you. Thank you so much. Okay, let me now turn to Mr. Akunzada. Mr. Akunzada, water and environmental authorities are increasingly recognized as key actors in public health surveillance due to their role in critical infrastructure and oversight of water quality systems. And effective wastewater and environmental surveillance requires close collaboration among water, health, and environmental sectors, which is still not achievable in reality. From your perspective as being the head of strategy and agency responsible for water resources and wastewater systems of Azerbaijan, what are the most important enabling factors for build such partnership among the water, health, and environmental sectors?
Thank you so much. From my experience, I would like to say the brief answer and the extended one. The brief answer is the cooperation. Successful wastewater and environmental programs depend first on strong cooperation, from the platform. The water sector collects very valuable data, but this data is a fragment of the big picture. There should be a platform where the various sectors, the public and the private, the health, public service, the local authorities, water, environmental, every player of this field should be part of the big picture. The data exchange, the experience exchange should build as a fragment of the big mosaic, how I can say. But the short answer is definitely the platform. But if I would like to add a couple of more, but to extend my answer, the first one is the strong governmental support and political will, definitely. Government needs to recognize water infrastructure or wastewater surveillance as a national priority. Luckily, in this January, it's still new state program for development of the potable wastewater and stormwater systems of Baku and Abşeron Peninsula, the capital. The state program has been approved by Mr. President himself. And in this state program, we are aiming to bring all these decision makers regarding to the infrastructure development, the public health, and the environmental factors to one table, how I can say. As I told, the second answer is definitely that table, the intergovernmental exchange platform, because the true partnership requires a clear platform where everyone knows which data should they collect, which data should they share, and how the decision-making procedures will be made. Because the reliable and timely exchange of the data in a critical periods will definitely affect the results of the project, the effectiveness of the project. In 2020, after the 2020, State Water Commission has been established in Azerbaijan, and the State Water Commission is a platform where back then we had 3 different water operators, one for the potable, one for the irrigation, and one for the water reservoirs. But regarding in the decision-making procedures, of course, all these 3 operators organization has their own way of thinking for the future perspectives, their own budget allocations, their own decision-making and reporting procedures. State Water Commission was a platform to bring all these 3, but not just them, also the Minister of Health, Minister of Finance, Minister of Economy, Ecology, and others, for making the decision-making procedure much more easier. The final answer is definitely sustainable finance, as Madam mentioned. The sustainable finance and technical capacity. You may be aware of yesterday, the government of Azerbaijan signed an agreement with OPEC Fund regarding to the construction of the Sumgayit wastewater treatment plant. Because as we work harder on to solve the issues, but everything comes to the end in the financial points. So sustainable and in general, sustainable finance is a key. Also, as the representative from the water sector, the development of the wastewater infrastructure, in general water infrastructure, is not, we don't count it as a just infrastructure project, because it will definitely lead to the positive environmental effects as the improvements in the quality of the Caspian Sea, also the public health, the social well-being of the population, plus proper wastewater treatment plants, proper sewage systems means alternative water resources, because as Azerbaijan's water resources is limited, as Azerbaijan is highly dependent from the transponder waters, which means that we need to control whatever we have properly. In that case, the proper wastewater treatment plants means better treatment, which means alternative water resources.
One more thing following on from that. What is the major challenge as Azerbaijan you are facing when developing your nationwide wastewater and environmental surveillance program, if you have? Yes.
I believe challenges are there to change them to the opportunities for the future. Definitely the main challenge is fragmentation, institutional fragmentation in the decision making, because as all countries has their own different agencies, ministries, and of course all these organizations has their own futuristic targets, their own budget allocations, their own capacity, and their own way of reporting the results. That's the main challenge, but it's also opportunity for example, as a platform like this is a kind of useful table for everyone to come together to do the experience exchange, also to learn from others' mistakes. The second challenge is definitely the limited technical capacity. Mm-hmm. Not just, I mean, of course, I believe in every country, some organizations has the difficulties in laboratory equipments, monitoring systems, also the number of the capacity, the number of engineers. And in Azerbaijan, we are newly established organization. We have established it in 2023. But last year we had a chance to establish a new master degree program in one of our governmental institutes for the, it's like the master program for the water resource management engineers. And by building proper, how we can change the challenge of the technical capacity to the opportunity for the future by investing the young generation, the current generation, to solve to make the better situation for the future generations, for the future of the countries and in general the Earls. The third one is definitely sustainable financing, as I mentioned in the as an answer of the first question, but by solving this challenge, I think there are very good opportunity as the international finance organizations, as ADB, as ISDB, as the EBRD, because by the cooperation with these organizations, we are not just solving the financing problem. We also have a chance to learn from international experience. We also have a chance to build a system, monitoring system, reporting system, and others in international standards as well. The final one, sorry, it was a bit long answer. The final one, the infrastructure gap. Infrastructure gap, especially in the wastewater systems, is the major challenge from many perspectives, from environmental, from public health, from the other perspectives. But infrastructure gap means if we can solve this challenge properly, because we are currently living in the technological century, which means that we have very advanced tools from AI, from the platforms where we can change our experiences, our mistakes. The infrastructure gaps can lead the opportunities for building the most modern, the most advanced systems for the country.
Thank you so much. Thank you so much for your contributions. And let me now turn to Mr. James Carty. The Gates Foundation has been working for wastewater and environmental surveillance, especially in low and middle income countries, through investments in pandemic preparedness, polio eradication, enteric disease control, and antimicrobial resistance. And today, countries seek to move from pilot projects to sustainable national systems. From the Gates Foundation perspective as a key driver for the innovation in the wastewater and environmental surveillance, what financing and partnership models do you believe are most effective for ensuring long-term adoption across countries with different governance structures, capacities, and priorities?
Thank you, Professor Bilger, for the question. It's a very important one. I'd also like to take this opportunity to thank the Islamic Development Bank for making time for this really important panel. I've been telling everyone that I've met so far about this really important panel on wastewater surveillance. Unfortunately, sewage doesn't have quite the same pulling power as hot topics like AI or trade and infrastructure, but it really should, because it really is the underpinnings of preventing the next pandemic, of ensuring that we're able to detect early and respond to potential pandemics. We have a long history with the ISDB, as Chris referred to earlier, working on polio, on water sanitation and hygiene, working through the LLF with our partners, the Abu Dhabi Fund for Development, Qatar Fund for Development, and King Salman Relief and Humanitarian Center, and the Islamic Concessional Financing Fund to fund some of this work. And so it's sort of a natural progression from that to looking at wastewater and environmental surveillance. So we're very grateful to the partnership with the Islamic Development Bank. In general, pilots don't fail because of the science. They fail because there's no agreement on how to scale up and sustain financing for that in the long run. Philanthropy is great at doing pilots, it's great at financing innovation, and along with overseas development assistance, we can do these things really well, but it's not a sustainable solution for long-term, system-wide scale-up and support in the long run. So that requires really three things. The first is it has to have country ownership, government ownership, and commitment to doing this, to make sure that it's fit into national budgets, that countries are asking for the financing to support this. That could be tailored to the countries, whatever is their particular pathogens that are most important for them in terms of their surveillance systems. Obviously, we've been working very closely with the WHO, with Dr. Hanan and her colleagues on normative guidance and standards to make sure that this can be integrated into country systems, international systems. But it really does require that country ownership first and foremost to make this a priority. The second piece is coordinating bodies. We're grateful, hugely grateful to the bank, to HERA from the EU, to the Hong Kong Institute of Philanthropy for bringing together the Funders Forum. You mentioned the wonderful meeting that happened in Istanbul, as well as the sort of disease surveillance funders collaborative, which was set up at the World Health Summit last year, and for that wider look at surveillance beyond just wastewater. So these bodies are really important to make sure that there is that coordination across the funders. But perhaps most importantly, it's about having the scale-up pathways. So how do you move beyond these pilots to ensure that these are scaled and sustained? It's not just about the finance, but it's also about the technical assistance, the capacity building, the ability to build implementation plans, create standards, etc., and of course the financing. And in terms of the financing, particularly in low and middle income settings, making sure that that financing is concessional as possible. So instruments like the LLF and the ICF are hugely important to enable that.
Following on from that, as Dr. Hanan mentioned, there are many humanitarian settings, conflict zones, and the disaster-affected areas. How do you envision the wastewater and environmental surveillance evolving as a tool for preparedness, early warning, and resilience in that zones, disaster zones, and the humanitarian settings, refugee camps? What is your opinion?
Well, I think it's vital to be able to adapt to address to address fragile settings. I mean, these are the places where it's most important to have that surveillance. You have a breakdown in the water sanitation and hygiene structures. You have the loss of clinics and hospitals, so that normally when people would present, that would be the first place that they would present. But if that infrastructure doesn't exist, you can't track through that. Dr. Hanan talked about the situation in Gaza, where the water sanitation and hygiene infrastructure was completely destroyed. There was sewage running in the streets. The usual vaccination campaigns had broken down, so you had numbers of people, young babies and infants, with zero-dose infants. So it's critical. These are the places where epidemics are bred, where these things can break out from. The advantage of wastewater surveillance is that it can be done in these settings. You don't need to have the health infrastructure for people to present, and it can actually give you a really early signal on things like cholera, polio, hepatitis, and other diseases before they show up in the population. You can track them through the environmental surveillance. But it does require adaptation, innovations in how to do this in much more simply, much more cheaply, and at scale. You have to get around the challenges of lab access, of cold chain, etc. And so investing in innovation to enable that is really important. It's a significant opportunity, but it requires collaboration across funders, across humanitarian actors, and so on. Helping to build these systems in the first place so that it's not just a reaction to an emergency, but making sure that they're there. Dr. Hanan again referred to Gaza, where luckily that infrastructure was already in place and was able to survive the terrible crisis. But that's the start, but you also then need to prepare for emergencies and make sure that it's integrated into humanitarian plans and responses.
Okay, thank you so much. And let me now turn to Dr. Ismane Elofe. CGIAR, the world's largest agricultural research and innovation network, working to transform food, land, and the water systems in the face of climate change, food insecurity, water scarcity, and emerging health challenges. And today, agricultural and livestock systems face increasing risks from the emerging diseases, and climate-driven water scarcity is accelerating the use of treated wastewater for the agricultural irrigation. As the directive of the CGIAR long championed the connections between agriculture, water, food systems, and health, how do you see wastewater and environmental surveillance contributing to One Health approach that strengthens early warning, safeguard food safety, monitors antimicrobial resistance, and supports the safe reuse of water, especially treated wastewater.
Thank you very much. And definitely the One Health approach is the right approach that we need to all invest in. And second, the wastewater environmental surveillance, it's the joint infrastructure that we need to use. The examples came from all colleagues, they were very important. We need really to make sure that we catch the resistance, we secure the food safety, and we recognize the risks. We have an early emerging diseases mechanism across animal, water, people, and also the earth that we are all working on and producing our food on. So this is very important. It matters the most for the antimicrobial resistance. We know that we need to produce more proteins, and there will be intensified livestock, poultry, fisheries in aquaculture. All of this is going to happen. So if we want to make sure that we don't get to the 10 million people that are going to die by 2050 if we don't address AMR particularly, we need to have those systems in place. And those systems in place could be really, it has to be joined as towards the One Health approach. AMR, it's not the only one. We have also issues of aflatoxins. Aflatoxins gonna go beyond the tropical area because of climate change, and we have already seen signals of that. And that's where, for me, really the work of the CGR centers, EMI and the Rewater MENA program, it's working with national systems, as James talked about, the fact that they need to own it and be part of it and design it or co-design it. So in Lebanon, for example, EMI have been helping Libnor to develop the country first water reuse national standards. In Jordan, in the Northern Valley, they facilitate dialogue that led the Ministry of Water and Irrigation to publish regular water quality data to farmers. So in all of this, really trust is very important. And to build that trust, you need data. You need data, you need independent institution that can bring this data to bear. And maybe to finalize, CGR evidence base across the 4 strands, the AMR, the food safety, the disease surveillance, and the reuse governance can really feed directly in the wastewater environment surveillance. And if we are looking at solutions, because it is important to state the importance of data and surveillance, but also it's very important to look at the solutions. I want to just end with one solution, looking at the One Health approach, which is the integrated rice fish system. So by raising the fish in the rice fields, farmers not only improve their food production, their rice and nutrition, but also their incomes, but also in the same time, the fish is feeding on the mosquito larvae, helping reduce malaria vector population, which is a very simple but very powerful illustration of how agricultural innovation can both simultaneously increase income for farmers, increase nutrition for everybody, but also reduce the hazard from certain diseases or larvae or insects or viruses. So looking for those nature positive solutions using the One Health approach is very important.
Okay, thank you so much. So you already answered my second part of question, but I want to ask the specifically your recommendations on the mechanisms needed to ensure to insights generated across those 3 different sectors, agriculture, water, health, and environmental, are effectively shared and translated into the coordinated action. I think this is the major challenge of the One Health approach. It looks very good in definition, but in application, it is not applied properly all around the world. So which mechanisms we should develop to achieve this?
Hanan mentioned the quadrilateral collaboration, which actually is between the 4 UN organizations that work on One Health, and that's a very important mechanism. But I think what joined us up is data. Could we really make sure that our data has all those aspects? And I think that's where effort has to be, given really the advance in AI, the advance in digital solutions. I think we need to make sure that information on disease surveillance, on livestock emission, on pesticide use are really joined up together. And we need to measure it. We need to have the right indexes, the right standards, the right measurement. And maybe lastly, what we need to do is our Codex Alimentaris, for example, it's looking only at food safety. It's not enough. It has to have that One Health approach. So it's about really our standards, because the standards make country implement them because they trade between each other. And unless you measure it rightly, you can't really address it in the right way. So I will push for data, and the right
Sharing.
standards that are really taking the whole spectrum of One Health approach.
Okay, thank you so much, Dr. Ismane, and thank you, all of you, for your valuable insights. And before we conclude our panel discussion, I would like to pose one final question to you to take your closing reflections very shortly. As environmental wastewater and environmental surveillance transform permanent pillar of the One Health approach, what is the single most important action? If I ask you one most important action needed to establish the minimum operational building blocks, what is your recommendation?
Thank you very much. I think there's a lot, of course, and I
Yes.
think it was integrated in many of our answers. But I think having that joint platform for discussing the value of wastewater surveillance, very much agree with Asmahan on the issue of data. And the reality that people in one sector, for example, people in the human sector, do not understand fully the value of the need of use of antibiotics in preventing, in securing the economical growth. And I think that communication will create a common understanding, and then that will push us to finding the solution. And one of the solutions that we found here because of these discussions that we're having on the One Health agenda is another topic that can have another session, which is the health in all policy and integrating the health in all policy development for each of the sector into the financial cycles of the country, so that the solutions can be integrated in each ministry line to be able to do what is needed to be done for mitigating disease outbreaks, if that's one outcome of the surveillance. But for me, it's not one thing, but it's one thing that leads to a whole lot of things. Thank you.
Thank you, Dr. Hanna. Yes, please.
And I will push for the coordination, because the platforms like One Health should be supported by public and private sector, by the government, international organizations, and the digitalization, the digital players of this sector as well. Because separately, the governmental institutions, the funding organizations, technology, these are key factors, but these key factors cannot solve the issue. The coordination between the players, coordination between the organization is I believe the most important action we should consider.
Okay, thank you, Mr. Riyad. Yes, James.
Thanks. I think for us it's also about creating a financing pipeline. It's a structured way to help countries bridge from the pilot to the sustained at-scale funding. There's a missing middle, if you like. We're great at the pilots, we have the funding mechanisms such as the ICF and the LLF, but how do you bridge between the two? And how do you translate that pilot into a high-quality, finance-ready investment? Identifying the pilots, the countries where this is happening, building the technical and economic case for that sustained financing, estimating the incremental cost, and then integrating it into national plans. But it's not just the financing, it's also the common standards and approaches, integrating that across countries and regions. We're able to do that through that common approach, through the pipeline approach, that allows better coordination response to human, animal, and environmental data, that enables a globally connected early warning system, serving One Health, as we've all been talking about, remembering it's not just about the human, it's also the animal parts of it as well. There is some pressing nature to this. There is some urgency. I mean, our financing for the pilots runs through 2027, but we need to sort of start building this pipeline to be able to scale and finance beyond that. If we get it right, we're measuring our success in as Chris referred to, the epidemics or the pandemics that didn't happen. Being able to do that early warning, that detection and that response is vital to stop that. We're hugely grateful for our partnerships with the bank, with the CGIAR, with WHO, with HERA and others, and country governments such as Turkey, Nigeria, Saudi Arabia and others that enable this to happen.
Okay, thank you, James. Yes, Ismail.
So I'll go back to the integrated platform of data between health, agriculture, water, environment at the national level and the global level. But I think also I want to end up that nature is interconnected. Yes. So if we throw something bad somewhere, it comes back to us. It doesn't go anywhere else. It's not disappearing. And hence, I think it's very important to look for solutions. For me, that wastewater shouldn't be waste. It should be treated and should be reused for agriculture. And this is very much needed because water scarcity is one of the major issues and the major threat for human at large. So we need definitely to invest as well in technologies to make sure how do we reduce the cost of treatment. Right now, many countries don't have standards but don't have capacity and investment or finance to really treat it. So we need to focus on technologies for treatment, reuse it for agriculture so we reduce the water scarcity and the food insecurity and malnutrition globally. Thank you.
Okay, thank you so much. Before handing over to the closing speaker, I thank to all of you for your insightful contributions. Today discussion has shown that wastewater and environmental surveillance is no longer a surveillance tool only. It is becoming a platform for collaboration, and it is becoming a platform for public health meets water management, where agriculture meets with environment protection, as your example is quite good. It's like an artificial symbiosis. I call this as an artificial symbiosis in my mind. And where science meet with policy, and where national priorities meet regional and global health security. And as we come to the end of session, I would like to express my deepest appreciation to the Islamic Development Bank for convening this discussion, providing us this opportunity to discuss this subject here. And I would like to invite the Nizar Zayed, Manager of Agriculture, Water Resources and Rural Development for closing remarks. Yes, floor is yours, Nizar.
Well, thank you very much. First of all, I would like really to ask you, colleagues, to give a second round of applause to our panel. Very rich panel, very diverse panel. You have research, you have philanthropies, you have UN agencies, you have academics. So it's really quite a very good panel which we were able to assemble, and I really wanted to thank them all to be with us today. Second, I want to maybe tell you, asking me to talk about, after so eminent people, about health and etc., is giving me really tough job, actually. But I will try to do my best, actually, to try to summarize the discussion. And started maybe with a personal note. You see, long time ago, I will not give you my age, I did a PhD on wastewater. And I was at the lab doing COD, chemical, BOD5, etc. And I have never thought one day I will be linking this to health and to environmental surveillance, etc. For me, it's just treating water to either to give it to farmers or to discharge it to the environment, which is clean. So today, it's really very, very interesting opportunity. And actually, we started with hearing what the experience of Turkey, how it started with COVID, and it moved from emergency to something which is long-term. And as one of our speakers mentioned, that the earlier you detect, the better we can prevent. And this is really one of the key messages you have to remain here. Of course, the annual meeting this year, the theme of the annual meeting has been regional integration for sustainable prosperity. What I would maybe phrase it differently for our session, it could be maybe national integration for sustainable cooperation. Because we heard from our colleagues about the challenges, about the institutions not working together, etc. And it emerged from the discussion that cooperation within the country, within the institutions, is very, very important for wastewater and environmental, wastewater and environmental surveillance. Of course, it was maybe summarizing the discussion. There was also a very, very interesting remark, Dr. Smahan, data, data, and data. This is very important to remember, and especially when we had a session yesterday about AI, etc., with our colleagues. So maybe it's the right time really to bridge the gap, actually, in terms of data and information between different institutions. Yes. Also, maybe and talking about the cooperation, etc., we heard from our colleagues from the Gates Foundation how it is important to cooperate between the banks and other partners, because we heard clearly the philanthropies can give resources for pilots, but to scale up, you have to have bigger money and bigger resources. This is one. Second, I don't know whether you heard it very well. James was telling us the money will not be there after 27. So for those who have projects for member countries, please do it as fast as we can. And we are ready to work with you, to work with WHO, to work with our Turkish partners to try to spread the West and use it in different member countries. Integration platforms, etc. Yes. Last thing, and I will conclude here. In Singapore, they don't use the word wastewater. They use the word used water. Yes. Because it's water which can be used again and used and reused many, many, many times. So this is really what we have to remember. It's first of all, it's a tool for public policy, for public health, for early detection, but also it's a resource which we can use for agriculture, for food security, and for a livable planet, as simple as that. Thank you very much.
Nizar, thank you so much. Do we have time to take a few questions from the room?
Of course.
Okay, because we exceeded our time, I know, but yes, if we have any... No, we
still have 13 minutes.
Okay, perfect.
Yeah, 13 minutes, 1-3.
Okay, then, okay. Floor is yours, dear audience. Please ask your questions, if any, to our panelists. Yes. Yes, please.
Assalamu alaikum. This is Zeba Nisa from Pakistan. First of all, I would like to appreciate the support of the Islamic Development Bank and the Gate Foundations while supporting the polio eradication project in Pakistan. It's a very effective project which have been supported by the IDB and the Gate Foundations, and it is supporting the local Pakistanis to eradicate the polio and contributing to the economic development of the country. Secondly, the investing in the regional health security with the focusing on used water and environmental surveillance, it's a very important, and I suggest and I appreciate the bank and the panelists that they have provided us a very good information while One Health platforms, while focusing on integrating or mainstreaming these sectors into the agriculture sectors, like it is also linked with the agriculture, food security, livestock, and also the private and public sectors. And the Azerbaijan colleague has also mentioned the strengthening the coordinations, which is very much important among all the stakeholders. They are working on the health sectors, agriculture sectors, for the use water and environmental surveillance. How, I have one question, like how do you think while integrating the localized institutions, local community into these new, into regional health security and wastewater and environmental surveillance, especially in context of the women empowerment and the youth engagements? Thank you.
Want to answer this question?
Yeah, thank you. I think you're highlighting a critical issue, and One of our colleagues, also the speakers, talked about the youth. You have mentioned the youth. I think it's mainly about awareness at this point. The functions that need to be done specifically for this discussion is really one of the core public health functions. And strengthening that core public health function becomes very important, and engaging them could be through engaging the community on anything that we do in public health is important. Otherwise we face, pushback and conspiracy theories start coming up. So I think through education, through understanding the relevance of this, but it goes also to the issues on hygiene as well. So I think even the civil societies have had, for example, a major push for the meat industry and the food industry on providing food that is not using antimicrobials and that's not using hormones, for example, that is camouflaged sometimes under the word food promotion or health, no, not food, growth promoters. I forgot that word. We used to use it a lot in AMR. So the word growth promoters is what? It's antibiotics, it's hormones, it's vitamins, it's a mixture of stuff that even the simple farmer does not know about. So the awareness of what they're eating and what they're drinking and what are they consuming, where do the disease come from, can create a huge partnership between the civil societies, the communities on the ground, and pushing governments and where they need to direct and put their investments and priorities. Because at the end, it is their health and it is their well-being that we're talking about.
Thank you. Thank you so much. Okay. Is there any other question? Yes, please.
Thank you very much. Mohammed Adouma. I'm the head of health in IGAD Secretariat. IGAD is in the Horn of Africa, where we have 4 countries from STP, Sudan, and Djibouti, Somalia, and Uganda. It's a very important topic, and I am very grateful to have this panelists. The question now of data sharing to make use of the information that we are getting from the other sectors. How to utilize the One Health sector into the health sector. And I think I would like the panelists maybe to reflect if there is any best practice that where we can use the information coming from like water, wastewater, or even climate health. They are very important to early predict the disease, but still the human health, the Minister of Health might not be benefiting or using this information. If there is any experience or any best practice that we can take and recommend. Thank you.
Okay. First maybe Ismane and then Tuhana. Okay? Yes. Okay. Because she is okay. And then I will give the floor to you as well.
I mentioned the example in Jordan and Lebanon, and there are 3 colleagues here from IMI, from the International Water Management Institute. Maybe colleague from IGAD, connect with them, they can give you the example. And basically the examples is really, farmers would like to use partially treated water for agriculture, but they don't trust it because the consumer does not trust it's good. So it's about how do you bring awareness, how do you bring trust in the data, and provide that data and be very transparent so it is used and it is not stopping those farmers from selling on the market and providing that transparency. But the colleagues are here, they know it far better, and they can give you the aspect on the policy side, the aspect on the engagement of communities, and engagement of other ministries like Ministry of Health or other ministries. Thank you.
Sana.
Yeah, and thank you, Ismahana. And again, we worked together in your previous role and had some great discussions as chief scientist of FAO. And yes, the quadripartite, and this is work that we've done from the governance part. And again, we're working again, when I was ADG in Geneva, working at global level, now at the regional level, we have something called the National Action Plans for Antimicrobial Resistance and also for One Health. So what we're hoping to do and working with the member states is to make sure that they can take their national action plans, which is a governance aspect. And this is very crucial because the integration of the different sectors to talk about data has to happen in a way that is supported by the highest level of the leadership. So when you have a multi-sectoral national committee, which we even have a tool on how to establish a multi-sectoral national committee on antimicrobial resistance, I've been advocating that those same committee members are the One Health people, right? So they can talk about not just AMR, they can talk about dengue, they can talk about polio, any other pathogen that or chemical or whatever that happens. It's the planetary health or One Health. So that is a structure that needs to be further activated, integrated, and supported at the highest level of the governments, and we're working through the different ministry lines to make sure that they don't forget. Because sometimes, especially for us as UN agencies, we develop so many tools and guidelines and frameworks and national action plans. We need to focus even more now on how to utilize these tools. There's tons of them, and tons of them are extremely relevant and very helpful. I promise as a regional director, I will continue, or WHO in general, we will continue to support that at the country level, and even those national action plans and the National Action Plan Committee, which is a multi-sectoral committee led by the minister lines that are relevant, they need to continue to invest in it and find the value because it mobilizes all of that. And I go back to including, because data is crucial, and your question was specifically about data. And that is where the data platform should be shared and supported and developed and identifying public health interventions to create the change that is needed in the different ministry lines. Ministry of Finance has to be part of that committee, and at least 5, 6 other ministry lines, education, social services, ministries of interior, and so on. So I hope that answers the question, and you're right, we have to do more on that front.
Okay, thank you so much.
Thank you very much.
Yes, please.
Hello, I'm Stephen Ferghese from the International Water Management Institute, and I actually have a question that's very linked to our colleague from IGAD, but let's say from the opposite end. So we know that health issues often emerge, human health issues often emerge because of agriculture, landscape management, and urban settings, and in humanitarian settings. And so my question is how environmental health monitoring, including wastewater and environmental surveillance, can actually and has linked back to those natural resource managers. So how can it inform the actions of the natural resource managers, and are there any particular examples that you can think of? Thank you.
You can answer this question, Mr. Roy.
I think to answer to this question, we need to see the nature itself. Because in the nature, for example, diseases also, for the water resources, the river, they don't recognize any borders. So they flow from the source to the end naturally, without any borders. Also, it's the same for the disease. So we need to implement, we need to do the same holistic approach for our challenges as well. If we bring, that's why I mentioned the integrated, the platforms to bring everyone together. Because, for example, taking the challenges of each sector, sometimes we can solve the problems or the challenges of the multiple sectors by one action. For example, the public health could be the result of improper sewage systems. Also, some environmental issues can be result of the improper sewage systems. Also, the water scarcity. If we don't have the local water resources, or if we have limited amount of water resources, that means that's also another challenge. But if we bring all these two different challenges to the one table, by solving the infrastructure problem, for example, the wastewater resource management, wastewater treatment, will lead the solutions to all these challenges. We will fix, by one investment, we will fix the environmental issue, we will fix the health issue, and we will fix the water availability issue. Also, the result of this, for example, let's take as an implementation of the investment and some report in general. If the result of this report will support by not just one, but multiple governmental organizations, and if it's supported by international standards, for example, or international financial institutes, that will be much more easier for the people to digest the result. For example, she mentioned in her speech that it's not easy for people, for agriculture, for farmers, to accept that we can use the treated water without any problem. But if the results, if our reports, if our investments will be supported by multiple governmental organizations, with also, and if it's supported by international standards, international organizations, that will be much more easier for the populations as well.
Okay, I think it's time. I know that there is a lot of interest in the room, but it's about 12:15, exactly, right on time. And because we have to give them the space to prepare for the next session, so I would like again...
Photo first, okay, before closing. Okay, thank you
Yes,
so
please.
much to the audience
Yes.
for participating in this important event. And, okay.
And let's have a group picture quickly. We can...
Yes, please.